And as public health officers, we want to say we are not happy. We are not happy because since the promulgation of the new constitution, this country has not prioritized employing public health officers and technicians. We have been having a budgetary allocation that has skewed towards curative. And you wonder, they keep saying prevention is better than cure, but this country, we speak prevention, then we eat curative. We have a lot of issues. Top of the 10 diseases in this country are preventable. Talk of diarrhea disease, talk of cholera, talk of other HIV. All those diseases are preventable. But we give investments more in curative as opposed to preventive. We want to thank you because you have embraced public health in this county. But we want to urge you, since 2005, this county has not employed the PHOs. I saw we had at least an engagement with the CEC. And we have agreed that at least we are going to prioritize employment and replacement of PHOs. It is very sad. If you look at the population of this county, is growing. We're talking about around 700,000 population. These dynamics need to merge with the HRH issues. They need to merge with the human resource. Right now, we are having around less than 100 PHOs in this county. And we need to talking about around 400 PHOs here. The WHO talks about one PHO should take around 7,000 of members of the population. And that's why you can be able to see most of the diseases that are actually upsurge. There's a projection that in the year 2030, we are going to have an increase in preventable diseases. So we are urging you, Bwana Governor, we know you're a wise man. We know you're a man of action. Please do the honorable thing. Embrace prevention. Just the same way our dear President, Honorable William Ruto, we did you a letter, Bwana President. We know you're not in this country, but we did a letter to you. We are willing to meet you as a union and tell you the solutions that are bedeviling public health in this country. We know we are surrounded by doctors. We know doctors are our friends. We don't fear them. They are our good colleagues. Some of them, we have married them. Some of them are our sisters and brothers. Some of them, we work, they are our neighbors. But surely, we must be able to embrace limits in terms of professionalism. So we want to urge the governor for Baringo, please employ PHOs, provide promotions. It is very hard. It's very sad. Since 2016, our colleagues have stagnated in one job for over 12 years, 15 years. When we're talking about staff morale, we're talking about even promotions. We have stagnated for almost those old years. They have gone to drain. We are asking you to do the honorable thing kindly and honor the way the CEC has said. Please promote our people, promote the PHOs, and you're going to see, I can assure you, you're going to see the results. Last but not least, we have something called community health strategy. Community health strategy, it must be noted, we gave birth to community strategy. If you go down the memory lane, if you go to the Ministry of Health, we had Dr. Mbacho, Dr. Mutari. Those are institute PHOs who gave birth to community health strategy. But sometimes it's being misunderstood. Most people take this community strategy, the chart, and run around with it without really understanding that it was born by public health officers and technicians. We are asking you, the Minister of Health, we are asking the President, please embrace public health officers. We don't want to see people suffering from COVID. We fought COVID down to our knees. We used CAP 242. For your information, Public Health Act is the mother, the grandfather of all the acts in this country. It was first enacted in the year 1921, September. In fact, it's the oldest act in this country. The president, His Excellency, the former president, used CAP 242 to control COVID-19. So, and it's still in force. What we are asking you, Mr. President, embrace public health officers and technicians so that we can be able to control monies that we are actually using to buy drugs in this country, and to build, they can be used even to build roads, to bring water, so that we can be able now to make sure that this country is very safe. So I want
Vice Chair for the Kenya Environmental Health and Public Health Practitioners Union. I want to urge the national government to pay our interns equally as they pay doctors and nurses. Another thing, I want to urge the governor of Baringo to do the honorable thing and absorb our UHC interns. They have been working here now close to 6 years, working on contract and being paid Mika salaries of 20,000 and 40,000, not equivalent to what other colleagues are being paid. And also we want to urge the government to employ the people who are working under the COVID response teams to be employed now to work. Now that we have an outbreak in China and slowly coming to Kenya, we have flu. Flu has now become so common in Kenya. We want to prevent that thing. Thank you so much.
Haya, tushikane mikono.
Yes, as Baringo County branch of Kenya Environmental Health and Public Health Officers Practitioners Union, we are facing, in Baringo branch, we are facing so many challenges. Key among them is unemployment of public health officers. We have quite a number. They have not been employed for a very long time. Previously we used to have 300 public health officers and technicians, but at the moment we are paltry 142. We demand for employment of public health officers, promotion of our public health officers and technicians, and we also demand for their redesignation and redesignation and replacement of our PHOs who have exited the service through natural attrition. Yeah, we've been left in the cold for a very long time, and the way to go now globally is actually public health. It's prevention. We need to upscale hand washing. We need to upscale pit latrine construction and use, and basically school health. At the moment, we do not have staff even to man key programs like school health, WASH, that is water, sanitation and hygiene, and we demand. We know our governor is able and he can do a lot for our county, but we want him to change now and focus on public health personnel, prevention and cure with regard to what I've said, and with that we shall eliminate the expenses on buying medicine, buying reagents and all that, because we shall deal with communicable diseases right at the grassroots level, right at the household level, the way our government is focusing. We stand behind our Secretary General, Brown Ashira, and the Nairobi team, and we promise that we shall, going forward, we are going to work public health way. Thank you very much.
Comrades, power. Let's also have our chair.